So tonight we're going to talk about wearables and aging. And one of the things that we've been looking at on my show Spark, and in my own research, has been the amount of data that we're just gathering and sharing and sending out into the ether. Data about, as you alluded to, about our behaviors, our activities, our movements, our preferences, our heart rates, all this kind of stuff. And there's tremendous potential in that data for real-world benefit to ourselves as individuals, but also groundbreaking potential benefit to the broader community, to us as a collective. And health is a big part of that picture. We realize that being active in our own health, we can improve our own personal health outlook, great. But we can also use that data about health for better research and better public health outcomes more generally. So the last decade brought us this information revolution of social media, Web 2.0 services like Wikipedia, YouTube, Facebook, where suddenly information was created and shared bottom up by individuals, all those status updates and photo sharing and posts and so forth. So looking ahead over the next 2 to 5 years, a new explosion of data is going to be at least as revolutionary. It's an explosion of data that'll transform our cities, transform how we work, the way we're educated, the kinds of information that's considered valuable, and indeed our healthcare. So what does this data explosion have to do with you and your activity tracker anyway? Well, what I'd like to argue is that the ability to, count your steps or your heart rate is tied into this much larger shift in the data that we're producing and what it can be used for. And this brings together the individual data that you're using to track your health with collected benefit. This is what The Atlantic says this month about what we mean by wearables in general. We're talking about something that you, wear, that's internet enabled, it gathers data about you or your environment, and it has the ability to communicate that data over the internet. So let me break down some of the ways that we're seeing this kind of wearable technology put into place. The most obvious way is just through these kinds of physical health trackers. This is the Fitbit. There are lots of other kinds of devices like this. Who here uses one of these things like a Fitbit or a Fuel Band? Right? So you're kind of on the cutting edge, because as much as we're seeing a lot of activity in this, we're also seeing that this is still sort of a niche activity. It's still an early adopter type of activity. So according to a recent Journal of the American Medical Association opinion piece, around 2% of Americans own one of these specifically dedicated devices right now. And they tend to, again, according to this article, be people who are under 35, well off, educated, and physically active. And so generally not the people who most need to be wearing these and benefiting from them. So that's niche now, but we're starting to see this incredible growth in this kind of area. So even if watches and these specifically dedicated devices don't take off, many of us already, in fact, essentially have wearables that we take around with us all the time, which is to say our phones. 68% of Canadians now own a smartphone, and many of us use apps to track things like how much exercise we're getting or to track our calories. So let's do a little straw poll. I asked about the dedicated devices. Do we have any old school pedometer wearers in the crowd? One. I wore a pedometer for a long time. Who uses an app on a smartphone to track something like movement or diet or mood? A few people. I do that as well. Well, it's interesting that we're starting to see this advance. There's good reason to believe that Canadians will take to this kind of fitness tracking and health tracking. We are, in general, as Canadians, enthusiastic adopters of new technology, and this habit of ours goes way back to our adoption of the old landline telephones in the early part of the 20th century. We have a higher percentage of smartphones than the US. We visit the most web pages per capita of any country in the world. So we are very technically advanced. We are early adopters. We're avid users of social media. And while senior citizens are the least likely to be online right now, they are also the fastest growing group of internet users. And one of the things that they most actively use the internet for is to find health information. But then if we want to think a little more broadly about healthy aging and optimal health, we can think a little bit more holistically about it and the potential for general health optimization. So there's huge potential in using wearables as assistive devices. For instance, at the University of Toronto, there's a lab called the TAG Lab, which is the Technologies for Aging Gracefully Lab. And they're working on designing wearables and apps to support memory. Now, I think most of us already, if you're anything like me anyway, you already use your phone as a bit of a memory assistant, relying on it for calendar notifications and all that kind of stuff. Well, they're taking it a step further. So, for instance, they have a technology like My Voice, which uses the location awareness properties of the phone to prompt people with cognitive impairments from stroke or Alzheimer's with words and names. So the idea here would be it knows that Nora is at CBC, and if she's at CBC, she's likely to need to know words like studio and interview, and if she's at her desk, she's likely to need to know the names of her colleagues and so forth, and it can literally prompt people based on the information that it thinks they need to know based on where you are. So we have all these little wearables and apps gathering data about us, but so far what we've seen is that in general, these various tools operate kind of separately, as separate companies, separate devices, separate apps, and they don't make it necessarily possible for that data to talk to each other. Or these tools are selling data to third parties as part of their business model, but they're not bringing that data together in a way that is useful for us. Because of course that's what we want when we can gather enough data that we can say, okay, when I eat these foods and I do my exercise at this time of day, I don't sleep well, right? We want to pull the data together so that we can start to make better correlations. And there is a big move to start to do just this, to gather the data in one place. In terms of optimal health during aging, a recent position paper by the Mars Center points out actually that what the future probably holds is not just the tracking of these wearable devices, but in prediction. So the thinking is that if we start to bring together all of this data from all these disparate sources about my eating habits and my exercise and so on, my wearables might actually be able to warn me about things. So say for the sake of argument, Nora, you're at risk of type 2 diabetes after age 65 based on the data that we're collecting about the patterns of your behavior. And this kind of thing has already been used in a research setting where, for instance, there's found to be a correlation between a change in the amount that someone is moving around and a prediction of depression. So this is very much at the experimental stage now, but we're starting to look at ways in which we could correlate this data with predictions of future health outcomes and have interventions earlier on to take advantage of that. If you think about aging in place, we're talking about wearables for monitoring health, but we're really more thinking about an ecosystem of devices and tools that can support us in healthy aging, of which wearables are a part. So what are some of the things we need to consider as we move into this new world? One is certainly this, right? We're buying these devices, we're strapping them to our wrists. Do they even help us live healthier lifestyle? Well, we're still in the early days of this, but unfortunately the early evidence about this is not so far all that convincing. Recently on Spark, I interviewed a health researcher at the University of Pennsylvania named Mitesh Patel, and they've been looking at fitness trackers and health, and the research is ongoing, but what they've said in a recent opinion piece is that basically the simple fact of owning one of these devices and tracking stuff doesn't improve people's fitness levels. It's a good way to assess where you're at, but the desire for behavior change comes first. So you can think of these fitness trackers or calorie counters as companions to your motivation, but not as replacements for them. Now, we're at the early stage of developments of these tools, so we're still in the process of learning how to apply what's known about behavior change to the design of the technologies. And I'm sure that we'll get better at designing them, but for now, it's not going to help you just to buy your spouse a Fitbit if they aren't already interested in getting more active. The motivation does seem to have to come first. I hope, anyway, that there's reason to be guardedly at least optimistic about the potential of this data for individual health. But what I'm really excited about is that we can potentially make people's health in general better by aggregating the kind of data that we're collecting as individuals. The hope here is that just as we can use data and analytics to improve our own personal health, we can bring about greater insights for public health by amassing this kind of data amongst numbers of people. Our phones may turn out to be the most important wearables we have in improving global health outcomes. So obviously we have some pretty interesting opportunities here when it comes to optimal aging and health. We can use the data personally and also to contribute in ways that help the community. To get the healthy future that we want, three factors are going to have to come together. personal activism around aging optimally and caring for our own health that's going to make these tools useful, a collective social engagement around how our data can offer health benefits more generally to people, and C, an activism around data which is going to make this data useful rather than a threat to our privacy. And all three of those pieces need to come together so that we can derive the benefit from these tools without sacrificing our privacy.
I have a Fitbit. I lost it, so I'm wearing an analog wearable. It's a watch, and I noticed today that I did not replace the battery. So it will be accurate twice today, and this is actually a legitimate issue around the practicalities of wearables. Sometimes people will lose them. Sometimes they will not recharge them. There was an excellent article in Wired magazine, which also has commentaries about technology and culture. And I think this comment was quite apropos. Wearables are totally failing the people who need them the most. And I think, who buys these right now? It seems to be mostly younger folks. They're relatively fit, they're relatively motivated, they are probably affluent enough to afford this and maybe affluent enough to lose it or upgrade to the next version. And the people who might benefit most from these are perhaps those who have mobility problems, where it would be useful, or you alluded to, would it be useful to understand whether somebody who is chronically ill, I work with psychiatry for the medically ill, would be very helpful, even within the hospital, for people we're caring about in the inpatient units to have more accurate data about just how active they've been. We typically get the snapshot of, well, the physiotherapist came by once, every 2-3 days and thought they were a little bit more active, or a family report that they were up and walking. But it's not a very good system of actually having slightly more objective data on how active they are, even in a hospital setting. And I think this comes back to some of the potential use value of even consumer wearables for understanding how active has somebody been in between, say, outpatient appointments. Could be a marker of worsening depression or a marker of deconditioning. And often when we're in the clinical setting and we're reassessing patients, we may not have seen them for 2 weeks, 4 weeks, 3 months. We rely on self-report or the report of a family member. I think if that were supplemented by some data from a wearable that was maybe a bit more accurate, and actually the research from Dr. Patel and others suggests that actually the accuracy of wearables and smartphones for tracking certain things like steps is quite accurate. So I do feel like having wearables on the right people at the right time could be quite clinically valuable. Our McMaster Optimal Aging portal, which is great for seeing, what evidence exists and cutting through all of the information out there. Very, very little high-quality evidence from clinical trials is out there. And I'll talk a little bit about how that may also be a bit of a barrier right now to getting these devices into clinical settings. But when you do a search on the portal and you look for wearables, there's really very few papers that come up. And in part, that speaks to the fact that there's not a lot of evidence right now that says, hey, these devices are going to benefit health. These are facilitators, but not necessarily drivers of health behavior change. There's quite a few steps that have to go in between. Dr. Patel and his team have said there's a big gap here between recording information and changing behavior. And right now, there's not a ton of evidence to support that these devices will change it. I feel like we're quite far behind in terms of health IT, and so there are still groups that are old school and some that are newer, and that does not always reflect improvements in care too, because I think there are also challenges with electronic medical records, and we hear about med students now who spend more time looking at their smartphone and their computer screen than engaging with patients as well. So it's not just about engaging with data, it's, as you were alluding to, using that in meaningful ways. If it helps to book appointment, if it helps with your personal fitness goals and the engagement, then that's the ideal.